Welcome, everybody. My name is Andrea Dalton. I am part of University Health Behavioral Health. I'm the director of the Center for Trauma-Informed Innovation. I'm also part of Metro Council. The Metropolitan Council of Community Mental Health Centers is a collaborative membership organization representing the public mental health system of community behavioral health centers serving the greater metropolitan Kansas City area. We provide support to our member organizations along with education, information, and resources to the public on accessing quality health services. We host the Mental Health KC Conference every May, as well as provide free webinars on the second and fourth Thursday of every month. And a quick plug also that we are hosting our fall symposium on substance use disorder and recovery on Monday, just this coming Monday, November 18th at Johnson County Community College. You can find out more about that. It's just an afternoon program. You can also register for that where you find more information on the mentalhealthkc.org website. So please check that out and register. We'd love to see you there. Hope to have a really good crowd for that. The program is really good. I'm really excited for it. Just a reminder before we get started today that the views and opinions presented are those of the speaker and do not necessarily represent the opinions of Metro Council. At the end of the webinar today, I will put a link and password to get the certificate of attendance for this webinar. So you'll be able to access that at that time. So make sure you stay till the end so that you can get that certificate of attendance. Another quick reminder just about the format of this webinar. It is in the webinar Zoom format, so you don't have video or audio capability. So we encourage you to participate as much as you can, as much as you'd like in the chat and in the Q&A. Feel free to type things in there along the way. I'm going to be keeping an eye on that and help monitor that for Chad as he's presenting. So with that, I'm excited to introduce Chad Childs. He will tell you more about himself and about what he's going to speak on today. Thanks, Chad, for joining us.
But thank you. Let's see, share my screen. Okay. There we go.
Sorry.
No, that's okay.
No, you should be able to.
Okay.
There it is.
All right. Okay. All right. Now I think I'm sharing the full slides. Is that right?
Yep, we got it.
Okay. All right. Thank you so much. Okay, I appreciate that. All right. Hi, everyone. Good afternoon. And my name is Chad Childs. My pronouns are he, him, and I'm a licensed clinical marriage and family therapist and a tobacco treatment specialist, though I'm not currently practicing. I'm honored to be with you all today to highlight some critical parts of our lives that have become overlooked and can be easily dismissed or minimized, and sometimes they need to be during a crisis. But it's important to keep some of these things in mind because we can build supports in crisis related to social connection as well. I grew up professionally in community mental health, and so I look forward to any opportunities I have to reconnect with my treatment people. And so I'm glad to be here with you all. I'm currently the Prevention Initiatives Manager for Wichita State University's Community Engagement Institute. And some of the content in this presentation comes from my peers, my colleagues that are at CEI's Center for Public Health Initiatives and the Public Health Aspire series in the recent past few months. Some of the content comes from my own education, studies, and experience. I think I shared a bio and that was going to be shared with you all. So if you want to learn any more about me, you can read that. But I want to share another important part of my own experience beyond that as a therapist and now a prevention professional. And that experience is my experience as a survivor. I'm a survivor of suicide loss, a survivor of my own suicide care, mental health treatment, and really thrown into my own crisis. And after a vehicle accident on June 21st, 2014, where I suffered a diffuse axonal injury, traumatic brain injury. So I am a TBI survivor, and my recovery was amazing. Um, uh, Really quick. I had great treatment in Salina, um, and then at Madonna Rehabilitation Hospital in Lincoln, Nebraska, and then some good outpatient occupational therapy, physical therapy, vision therapy, and um, was doing really well. And then the fact that I survived became a hardship, became hard for me, and survivor's guilt piled on. Um, so after probably several months, maybe 3, 4, 5 months after the accident, I started to isolate considerably. Um, I was working full time, well, almost full time. I would have to stop early some days because of fatigue. Um, but I isolated myself quite a bit and became suicidal. Um, Luckily, I still had um, some memories of what could help someone in my situation, and so I got support through Crisis Helpline, through traumatic brain injury support groups, through my support network, um, and therapy and medication management for myself. And one of the things that stands out as being really instrumental in my own recovery was my therapist at the time shared with me a section from Mary Karr's poem In Cant Against Suicide. And the part of that that really stood out and has been important for me since then um, is it goes like this. Your head's a bad neighborhood. Don't go there alone. Even if you have to stop strangers to ask the way, and even if spiders fall from your mouth, your open mouth. This talk's their only exit. And I can share the full text of that poem, or you can Google it if you'd like. It was really powerful for me and has continued to be really important to me as far as um, how, as an overthinker already before the accident, and a recovering perfectionist, and the firstborn, um, lots of reasons why I kept a lot of things to myself. Um, and so this topic is really important to me, and I was not healthy when I was not having social connections. Um, but I became healthy, and I remembered reasons for living because of social connection. Socializing takes practice. I was out of practice. I'm still a little bit rusty here 10 years later. Um, but it does take practice. And the pandemic response to less socializing um, did impact me, but in some ways it was a positive experience because when we returned to work virtually, um, it for some reason I found an opportunity to grow socially through online connections. So it's some of the good and bad of our pandemic response to COVID-19. Um, I grew socially through virtual life, and then that led to social connection in real life. Um, it also, one of the things that this topic reminds me of is a feeling of the feeling of community. And I have not found a great way to describe this feeling. And so I'm going to invite you all to help me with this. Don't enter anything into the chat yet. But when I say enter, so I'm going to ask you to type out some keywords, so what I'm going to describe in a second, and then hit send enter or send when I say, okay, share. And so this is going to be our little bit of a recreated form of social connection and community. And what I'm asking you to do is type something out that describes the feeling of community. And so the feeling that I'm trying to describe for you all, that I'm looking for your words to better describe, is that when you feel like you're with other people that are your people. And it's not just oh, I know these people. It's a feeling, it's a kind of a warm feeling. It's sometimes a tingling feeling. It's a very uplifting feeling. And it might be groups of people like your classmates, maybe at a high school reunion, maybe at church is where you find in your church family, you find this feeling of connection and community. Maybe it's with your coworkers at like retreats or something fun. Maybe it's when you're working hard on a collaborative project. For me, most recently, it has come at farmers markets where I can go to a farmer's market and I have gone enough that I'm comfortable and I feel like I belong there. And feel comfortable, feel safe, safe enough to practice things like patience, things that I don't always practice. But so it's that kind of a feeling. So I've talked about it way too much, but so hopefully you have something typed in the chat, and I'm gonna watch the chat to see this happen. So on the count of 3, I want you to describe that feeling of community and hit send. So 1, 2, 3, send. Okay. Okay. So look at that cascading of things in the chat. I'm not going to read them all aloud, but I ask you to just scroll with me and just take 30 seconds here to reflect and try to feel the feeling of community that you just described. Okay, thank you. So I'm going to, okay, before I go too far away, that's beautiful and amazing. And I plan to save this chat to be inspired in future times. So I'm going to share the full text of the poem by Mary Karr there, because that was requested in the chat. But thank you so much for doing that. Okay. I hope you can feel that and hold on to that feeling at times during today and the rest of your week. Okay, so you probably are familiar with social determinants of health. Healthy People 2030 outlines national data-driven objectives to improve health and well-being through the Office of Disease Prevention and Health Promotion. Healthy People 2030 defines social determinants of health as the conditions in the environments where people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning and quality of life outcomes and risks. Social determinants of health considers the structural and systemic inequities or inequalities that contribute to health disparities in order to make effective efforts, to make effective efforts to achieve health equity, we must address all components of the social determinants of health. An example of the many ways you can apply this information today is that I'll be focusing on our social and community context and how that affects health outcomes. And when I say health outcomes, I'm going to be including mental and physical every time I say health. So here is Healthy People 2030's goal to increase social and community support, and then some of the words there that I just shared with you all. So we're going to focus on that social support. Many of you also may be familiar with this resource that I've used for some guidance. This resource is the 2023 U.S. Surgeon General's report on loneliness and isolation and the healing effects of social connection and community. The report's 80+ pages in length, so I pulled out a few areas to discuss today that are key for mental health. I've referenced a few of these concepts already, and next we'll explore others discussed within the report, the first being the 3 vital components of social connection. And it's a great report, advisory documents, and I encourage you all to read it if you haven't already. There are a lot of good things there that really help us see the needed bridge between physical health care and mental health care. Excuse me. This graphic here is from the advisory, and it shows how, in a graphic format, how social connection influences health. And so we can see components of social connection have influence on our biological processes, our psychological processes, and our behaviors. And all of those processes have impacts on our health. And the health examples listed in this graphic are mostly physical, but mental health is an important part of our overall health, and the CDC has drawn the connection between social isolation and loneliness and increases for risk of depression, anxiety, suicidality, and self-harm. Social connection is a critical and underappreciated contributor to our individual and population level health, community safety, resilience, and prosperity. However, far too many Americans lack social connection in one or more ways. This really compromises the benefits of social connection and can lead to poor health and other negative outcomes. Social connection can encompass the interactions, relationships, roles, and sense of connection that individuals, communities, or society may experience. An individual's level of social connection is not simply determined by the number of close relationships they have. There are many ways that we can connect socially and many ways that we can lack social connection. These generally fall under one of 3 vital components of social connection: structure, function, and quality. The components there are described with some examples of structure: our household size, friend circle size, marital partnership status. Examples of function, excuse me, are emotional support, mentorship, and support in a crisis. Examples of quality as a component of social connection are relationship satisfaction, relationship strain, and social inclusion or exclusion. These 3 vital components are each important for health and may influence health and mental health in different ways. Social connection is dynamic. The amount and quality of social connection in our lives is not static. Social connectedness changes over time and can be improved or compromised for a myriad of reasons: illness, moves, job transitions, countless other life events, as well as changes in one's community and society, can all impact social connectedness in one direction or another. A wide variety of factors can influence an individual or community's level of social connection. One organizing tool that helps us better understand these factors is the socio-ecological model. I'm sure that some of you have seen this model or heard of it, heard it said more eloquently than I just fumbled through it. And you may have experience using it. The model organizes the interrelated factors that affect health on the individual level in our relationships, in our communities, and in society. Connectedness is influenced by more than just our personal or interpersonal factors. It's shaped by the social infrastructure or the communities in which we're born, we grow up, we learn, we play, we work, we worship, we age. Social infrastructure includes the physical assets of a community as well, like libraries and parks, programs like volunteer organizations or member associations, and local policies like public transportation and housing. Each of these levels, from the smallest to the broadest, contribute to the social connection and its associated risks, and also its protection for health. Let's take a look at each of the 4 factors individually, and we'll start with individual. For this first factor, I'm going to introduce an example that I'll carry through the rest. Let's get another drink. So in this example is based on a former client of mine when I was a children's community case manager. My client had impairments in almost all of the areas down this list. And on top of it was a teenager. And so that ought to be its own big flashing challenge to individual components of social connection. Our community-based services for this client were as involved as they could safely be. But even then, they weren't able to change most of these individual factors for my client. We would feel defeated that there weren't enough changes happening for this person in their life. And I still look back on that as with a lot of I wish kind of the statements, or I could have, or I wish I would have kind of thoughts. Factor 2 is about relationships. My client struggled through relationships, and this was shaped by and shaped much of his experiences and worldview. Even when he was doing his best functioning as an individual, he asked me why we were working on things and talking so much about options for his future. When I asked him what he wanted to do when he grew up, when he went on to live on his own, he looked at me in a sincerely confused glance. And he said, "I'm going to be locked up." I explored this further with him, testing out if there were any current plans to do something illegal that would get him locked up. But it was broader than that. He confidently, assuredly said, "My dad is locked up. My brothers are locked up. I'm going to be locked up in jail or prison too." And so that was part of and came from all of these relationship components of social connection. For my client in factor 3, with community, the community factor felt like it expected him to be locked up as an adult also. He had a lot of resources available in the community, but they all required help from someone else for him to use because he wasn't able or willing or confident enough to use them on his own. This reinforced his feeling that he was only expected to be locked up. It felt like it was just a matter of time for him. Factor 4 is society, and society refers to a broad group of people sharing cultural, economic, or social ties, while a community is a specific group of people with shared interests or locality. So the list here is norms and values, public policies, technology, environment and use, civic engagement, demographic norms, historical inequalities. For my client, the societal factor didn't offer much that he could access to change his life trajectory. In summary, because many contributors to social connection go beyond the individual's control, in order to promote health, change is needed across the full scope of the social ecological model. While every factor listed in the previous slides, as well as some not captured, can be important contributors to social connection, it's important to look across all these levels. That gives us clues to barriers to connection and the types of interventions which could successfully increase social connection. The broader view can also help identify what places groups of people at highest risk for social isolation and loneliness, as well as factors that reinforce cycles of risk or resilience. This will be a little bit tricky to see on your screens. But these are some national trends for social connection. And the graphs they tell a story. And so it's important to kind of look at what that story is. And I'll try to summarize some of them. Our social networks are getting smaller. The number of close friendships that we have has declined over several decades. Among people not reporting loneliness or social isolation, nearly 90% have 3 or more confidants. Almost half of Americans, 49% in 2021, reported having 3 or fewer close friends. Only about a quarter reported the same in 1990. So that percentage has grown almost, well, more than, very close to doubled percentage-wise. Social connection continued to decline during the COVID-19 pandemic, with one study finding a 16% decrease in network size from June 2019 just to June 2020. I'm sorry about my voice. Levels of social participation are also declining. Social participation might be time spent with friends. COVID-19 pandemic accelerated those trends, and the Surgeon General report highlights this as well. There were demographic trends. Family size has been steadily declining since the 60s. Marriage rates have been declining, and living alone has increased decade to decade, from 13% people living alone in 1960 to 29% in 2022. Community involvement trends, like a community attachment, highlight how there are less people getting involved in different community activities. And one of the noted ones in the report was in 2020, 47% of Americans said that they belonged to a church, synagogue, or mosque. 47% in 2020. In 1999, that was 70%. So it's a huge, huge drop as well. For higher risk groups, our highest risk groups, social connection becomes even more important. Studies find that the highest prevalence for loneliness and isolation among people is with people who have poor physical or mental health, have disabilities, have financial insecurity, those who live alone, single parents, as well as younger and older populations. Older adults have the highest rates of social isolation. Young adults are almost twice as likely to report feeling lonely than those over 65. The rate of loneliness among young adults has increased every year between 1976 and 2019. Lower income adults are more likely to be lonely than those with higher incomes. 63% of adults who earn less than $50,000 per year are considered lonely, which is 10 percentage points higher than those who earn more than $50,000 a year. Additional at-risk groups may include individuals from ethnic and racial minority groups, LGBTQ+ individuals, rural residents, victims of domestic violence, those who experience discrimination and marginalization are also a part of the higher risk groups for social disconnection. Technology has had a huge impact on social connection as well, and I think we're finally catching up to some large research studies to look at the impacts of the good and bad that can come from technology with social connection. So people from rural areas, people with disabilities, and adults with lower incomes are likely to have less access to consistent internet. So that has pros and cons, as you can imagine, with the internet helping some people with connections and decreasing some other ways of showing connections. So, for example, of the disparities that come here is people from rural areas might have difficulty getting access to the internet or Wi-Fi, and that would be different if they were to live in a larger city, larger community. In a US study, participants who reported using social media for more than 2 hours a day had about double the odds of reporting feelings of social isolation compared to those who use it for less than 30 minutes a day. Targets of online harassment report feelings of increased loneliness, isolation, and relationship problems, as well as lower self-esteem and trust in others. Evidence shows that even perpetrators of cyberbullying experience weakened emotional bonds with social contacts and deficits in perceived belongingness. Nearly all teens and adults under 65, is 95 to 99% of them, and 75% of adults 65 and over say they use the internet. Americans spend an average of 6 hours a day on digital media. 1 in 3 US adults report they are online almost constantly. The percent of teens ages 13 to 17 who say they're online almost constantly has doubled since 2015. The percentage of adults who reported using social media increased from 5% in 2005 to about 80% in 2019. Among teens 13 to 17, 95% report using social media as of 2022, with more than half reporting it would be hard to give it up. Relatively high among all groups of Americans. The following groups experience a persistent digital divide: less likely to own their own devices, and those are people with disabilities and adults with lower incomes. Risk and resilience can be reinforcing. So the better social connection that we have can lead to better health, and less social connection can lead to poorer health, mental health included. This is a virtuous cycle between social connection and volunteerism or service. Those who are more connected to their communities are more likely to engage in service for their communities. Those who are engaged in service are more likely to feel connected to their communities and the individuals in it. Interestingly, there's evidence that the well-being benefits associated with volunteering excuse me, are even greater for those with higher social connectedness than those with less. Because these cycles can be reinforcing, prioritizing social connection can not only disrupt vicious cycles, but also reinforce virtuous ones. However, there's some caution here for when poorer health leads to isolation. Being in poorer health can become a barrier to engaging socially, reducing social opportunities and support, and reinforcing a vicious cycle of poorer health and less connection. And individuals achieving financial insecurity or financial security may require working multiple jobs, resulting in less leisure time and limiting opportunities for social participation and connection, which in turn could provide fewer resources and financial opportunities. So it's not just money that's going to solve this problem. It's not just that we don't make enough money to be socially connected. The Surgeon General's framework includes the 6 pillars to advance social connections. In this framework, we'll see that the strategy is the next critical step to move toward action and is essential to our nation's health, safety, and prosperity. I'm sorry, I'm going to take another. Some mix of asthma, allergy, and anxiety. So the 6 pillars are organized by stakeholder group and support a whole of society approach to advancing social connection. Benefits of using the national strategy include cultivating individual health and well-being, strengthening community health, safety, and prosperity, and building resilience for the next set of challenges, as well as advancing civic engagement and representative government. We know that it's far-reaching, but we're going to take a look at each of these 6 pillars and bring it back to a local level on Kansas. Here are the 6. I'll go through them all individually. Pillar 1 is strengthen social infrastructure to local communities. This pillar emphasizes the importance of designing environments that foster connection, social connection. It involves creating public spaces like parks, libraries, and community centers to encourage interactions. Pillar 2 is enact pro-connection public policies. So this emphasizes integrating social connection into all policy decisions using a connection in all policies approach. Pillar 3 is mobilize the mental health sector. This calls for professionals to be equipped to address social disconnection as a part of standard of care. It involves training clinicians, mental health staff, and healthcare to assess and support patients facing loneliness or isolation and incorporating social connection into prevention strategies, surveillance, and interventions. Pillar 5 addresses the need to redesign technology in a way that promotes healthy social connection and limits its potential harms. This includes ensuring transparency from tech companies regarding the effects of their platforms and enforcing safety standards, particularly for minors. Pillar 5 is deepen our knowledge. It calls for developing a national research agenda to better understand social disconnection, its causes, and the effectiveness of interventions. Pillar 6 is build a culture of connection. This emphasizes the need to foster societal values like kindness, respect, service, and commitment to others to strengthen social connection. Individuals, leaders, and institutions are encouraged to model these values in public and private dialogue, as well as in schools, workplaces, and communities. This pillar stresses that societal norms, media, and storytelling play vital roles in shaping behaviors that support a culture of connection. For mental health and well-being professionals, it's important that we establish social connection as a priority health and mental health indicator and social determinant of health with the goal of improving health and well-being through programs, education, research, and promotion of healthy lifestyles across the lifespan. We can develop, lead, and support public education programs, awareness campaigns, and health professional training programs focused on the health impacts of social disconnection. We can integrate social connection as a key component of health promotion and wellness programs focused on related health issues. For example, suicide, workplace burnout, and substance use. We can study and support research on the causes of social disconnection. We can evaluate, develop, and implement sustainable interventions and strategies like programs, campaigns, toolkits, and partnerships across the socio-ecological model to promote greater connection and prevent social disconnection. We can also consistently and regularly track social connection using validated metrics, and we could use this to encourage supporting treatment goals, creation of treatment goals and objectives that are focused on increasing positive social connection. So there are a lot of different ideas here listed in some big words, but how this can come home in our support of individuals can look a lot of different ways. And as I've learned through the years that the best treatment is an evidence-based strategy that's adapted to specifically serve the individual. And the best prevention strategy is an evidence-based strategy that's adaptable enough to meet unique needs and strengths. The same is true with social connection. Not one size is, we're not going to find a solution through a one-size-fits-all approach, because people feel connection and feel community in very different and unique ways. And that's one of the incredible things about it, and one of the reasons why it really is important to focus on our relationships as a part of our treatment planning and supporting folks. This is my end of the presentation and the end of hopefully me coughing and having some voice troubles. But I want to thank you all very much, and I'll stop here and see if there are any questions or conversations that you want to have.
That was really great information, Chad. Thank you.
Oh, yeah.
We'll just pause and see if people have some questions. I know there's lots of questions about getting the certificate of attendance. I'll put that in the chat when we're done. Hang on, just another few minutes. I think this is such important information for us all to be paying attention to, like for ourselves individually, but also for each other. You know, that idea of collective care, community care is something that I feel is really important in not just the work that I do, but in life.
Yeah.
And I think you know, people are recognizing that maybe a little bit more because of the pandemic, as you kind of talked about. But it was important before then too.
Yeah.
And
yeah,
it will remain important even as we find ways to be together in person and those kinds of things again. It's more complex than just you know, being out in public.
Yeah, it is very much so. Yeah, and I think one of the things that I've taken with me is that if I were to go back into practicing therapy again, one of the things that I really would do was build into treatment plans or build into kind of a relapse prevention plan, that really elevating the social support and social connection system of all of that planning, because I think it is really important, especially to the way that we connect socially now is very different than it was 20, 30, 40 years ago. And so our plans for practicing and stretching ourselves to stay connected needs to change with that time as well.
Yeah, absolutely. Absolutely. I don't, oh wait, here's in the Q&A.
Okay.
Someone was asking if your slides will be available.
Yeah, I
Are
can
way
send
into the
them.
practical details today. I
That's right.
appreciate
That's
that.
right. That's right. Oh yeah, I can definitely make them available. I can save them and send them on. Should I send them to Jamie or do you want me to send them?
Yes.
Okay.
I'll see how we can make that happen. I think we
Okay.
can also send them out to people who registered, perhaps. And
Okay.
do it that way. We will work on that.
Okay.
There's a question from Joanne. Could this be shared at the county level around the state?
Yeah, and so that's something that I know because of my work with in collaboration with the Center for Public Health Initiatives. I know that they are supporting this work, this training for community health workers. And so I think connecting with community health workers and peers in your counties and talking with them about social connection and disconnection, I think would be a great way to give them an opportunity to share some of the real life benefits and experiences that they've had from social connection. And then that can be explored at looking at how can we replicate this in our county, because all of the counties are going to have, just as we all as individuals have unique ways of connecting, all of our counties have unique ways of fostering connection through their infrastructure and their cultural events and community activities. So yeah, it definitely could be something that could be shared at a county level. As far as if that is a technical question or request, I don't know about presenting the presentation at 105 counties, but I think it's a good opportunity to explore your local resources. Also, my day job is supporting the Kansas Prevention Collaborative in a large part of my day. The Kansas Prevention Collaborative supports community coalitions that are focused on prevention of substance use, and some organizations and coalitions that are preventing suicide as well. And so this type of a training or presentation, or this type of a kind of a looking at how are we as a community supporting social connection, I think would be a very worthwhile agenda topic for some of those local meetings.
Yeah, for sure. I don't think there's any other questions, but there's a couple comments in the chat. Erica has said the pandemic exacerbated what was already there. We need more connection to see how we're connected, like 6 degrees of separation. We have to be role models. I think she might be speaking from the perspective of a provider, being
Yeah,
a role
that's a great
model for
point.
how we do that. And then I say that because I know Erica, so I know the
Okay.
kind of work that she does.
Yes.
And then Jennifer said, sometimes when I suggest building social connections to clients, they're resistant to it, saying that they're an introvert or prefer to be to themselves.
Yeah, and that's something that was very, I know that, I'm trying to just remember exactly. I was much more extroverted before my injury. After my injury, I fully moved into more introverted energy, and that was a lot of that had to do with shame. A lot of that had to do with comparing myself to my past self. And so I didn't want someone to have an experience of me struggling much more than I used to. And a lot of that came from I didn't have enough energy to go to all of the social things that folks were doing. I just had enough energy to barely make it by. And so I definitely can relate to that. And I think it was good for me to practice and to kind of think of it as part of my recovery plan, was to how I could make some goals. And if it was too much social stuff that was too draining, then I knew I needed to back up a little bit. And if I were to or to give myself advice from where I was at that time, it would be to be patient with yourself, and that your desire to have more social connection might come later. Don't force it. And at the same time, practice, find some safe ways to practice. And so for me, some of that was online, some of that was individual meetings, some meetings with, some gatherings with close friends in a really controlled environment. And then gradually going on to, I think, eating lunch with coworkers or something like that. So gradually, patience, it takes practice for sure.
Yeah, definitely. And not setting firm boundaries around your expectations for what it's going to look like, or even how you are going to be individually, because so many things change throughout life, and
That's right.
Big and small things can make an impact on that.
Yeah, very true. Yeah.
Great. Well, I don't see any other questions or comments in the chat. Any last thoughts you want to share with us, Chad?
Thank you for being here. Thank you for what you're doing. And keep making a difference in people's lives. And I love that you love what I love. And we'll keep finding each other.
That's awesome. Thanks so much, Chad. This was really great. Really appreciate you sharing your story, your life, and your work with everyone.
Yeah.
Just a reminder to everybody that we did record this, so you'll be able to access it later on the Metro Council YouTube channel. If you go find that YouTube channel, I put the link in the chat, you can subscribe and then you'll get the notification when that new video is available. Give us a little time. Remember, we're all volunteers. And so sometimes it takes us a bit to get those things going, but we appreciate your patience with that. You can also access the certificate of attendance in the chat. I've dropped the link. You'll have to type in the password in order to get to that certificate of attendance. I will hang on here just a little bit to make sure that if there are any other kind of logistical issues that I can help take care of that. But that concludes our webinar for today. Again, quick reminder that we have the fall symposium on Monday. Really, again, strongly encourage you all to attend if you're able to. Should be some great information, especially on recovery and SUD. And while we typically have these webinars on the second and fourth Thursdays of the month, the fourth Thursday of this month happens to be Thanksgiving. So we will not have a webinar that day. You can join us again on December 12th for the next webinar. Thanks, everybody. Have a great day.
Thank you all.